Since its inception in 2012, World Lung Cancer Day has been observed every year on August 1st. Lung cancer was a rare disease in the early 20th century, but its incidence has gradually increased with increase in the habit of smoking. Now it has become one of the most common cases of cancers in the world. As per the latest report by the WHO, 2.21 million new cases of lung cancer have been reported. With COVID pandemic, lung health needs to be given much more importance. It is important to quit smoking as lung cancer is definitely a preventable disease, and smoking is the thing that aggravates and is one of the most common reasons behind lung cancer. In this initiative of Lung Cancer Day, Medicircle is conducting a series on lung cancer awareness to beat cancer and achieve healthy lungs for a better future. Hello, I'm Smita Kumar, and today our guest for the talk is Dr. Nisha Vishnu. Dr. Nisha Vishnu is a radiation oncologist with expertise in advanced radiation oncology techniques, having experience in oncological patients management and clinical research. She is working as a radiation oncologist in Fortis Hospitals and Max Clinics in Bangalore. Hello, Dr. Nisha. Welcome to Medicircle.
Hi, Smita. Thank you for having me here. And please shoot the questions.
Sure. So, Doctor, the first question is like, how does one put oneself at a risk of lung cancer?
So, the most important way to put oneself at higher risk for developing lung cancer is by consuming tobacco, especially by smoking, be it BD or cigarette, like you have already put it up in the introduction. But having said that, non-smokers or never smokers do get diagnosed with lung cancer. So there has to be other reasons as well. Usually more than one risk factors work together to cause lung cancer. Now, some of them are genetic susceptibility, poor nutrition, exposure to radiation at an early stage or early age, or exposure to environmental gases like radon, or occupational exposure to harmful stuff like aluminium or nickel or arsenic, etc. Air pollution, be it vehicular or industrial or domestic like chulas, or prolonged chronic lung diseases. Now the list of risk factors is very long, and we don't know the entire list of the risk factors yet.
Okay. But as you just mentioned that there are some cases where there is industry emissions, and this is also causing lung cancer to a lot of other studies. Even a study of, there's another study which also says that it is just not that the smokers, like the people who are having tobacco, are only having lung cancer. There are a lot of other peoples also are having lung cancer. So is lung cancer very much geography specific, and does it affect a particular segment of the population?
So yes, of course. I just enumerated the risk factors and the causes of lung cancer. Now, a geographical area where the risk factors are more prevalent, the risk factors that I just enumerated. So where those are more prevalent would be naturally be having more lung cancer incidents. Now, hence a society where smoking is almost endemic would have more individuals developing lung cancer, or a geographical area having more background natural radiation like radon or thoron might see slightly more number of lung cancers. And like I said, usually multiple factors independently or together at different points of time causes genetic mutation or damage. And the accumulation of these damages produces a cancer, any cancer for that matter. And this happens over a long period of time, and that is why usually lung cancer is a disease of elderly or older age people, though it is diagnosed in younger age as well.
Dr. Nisha, one very important question here, that many a times it is this disease, the lung cancer, is having common symptoms just as tuberculosis. So, and it gets sometimes undiagnosed, and it is treated at a very later age, and where it becomes really difficult to make this disease irreversible. So how is lung cancer diagnosed primarily, and how it can be treated?
Now, this is a really long question. The answer is going to be really long, Smita. So when a patient suspected with lung cancer comes to our hospital, the goal is correct diagnosis and accurate staging so that appropriate therapy can be administered in a timely fashion. The general approach towards treating cancer is usually tailored not only to the clinical presentation of each of our patients, but also as per the overall health, logistics, and preferences of our patients. Now, the first step towards diagnosis is a thorough history and physical examination. Based on that, we usually ask our patients to undergo some form of imaging, starting with a simple chest X-ray and then a chest CT scan or a whole body PET scan. This helps us to diagnose and find out the stage of the disease, and also know from where to put a needle for the biopsy. So coming to biopsy, which is the most important aspect of lung cancer diagnosis, it is nothing but putting a needle into the tumor, taking a small chunk of it and looking it under the microscope. This can be done using a bronchoscope, that is a tube with a camera that goes into the patient's respiratory pipes, or can be image guided like a CT scan. Now, this small chunk of tumor gives us information about the type of cancer that it is, or the biological aggressiveness of the tumor. And also, we run some tests to find out the molecular markers that can guide us in the treatment. We also run a gamut of blood tests to assess the general blood counts, kidney function, liver function, and the general health of the patients, and we get to know the general health of the patients from that. Now, there are tests to assess the overall and the lung-specific fitness of the patient so that we know if patients are fit for different treatment modalities. Now, once we have all these informations, we give the final diagnosis with stage and biology of the tumor. In the institutes that I work, we put the case through a multi-speciality tumor board, wherein each case is discussed thoroughly between the surgical, radiation, and medical oncologist, the pathologist, radiologist, nuclear medicine specialist, etc. And a treatment plan is finalized after discussing with patient and family their preferences as well. Now, for early stage lung cancer, surgery is considered to be the gold standard. Some patients are not fit for surgery because they are too old or have too many adjoining health conditions. We still can cure them in early stages with the non-invasive equivalent of surgery, and we call it as the stereotactic body radiotherapy. And for patients with a locally advanced lung cancer, that is, the cancer has spread to nearby areas or to the nodal stations, but without distant spread, that is no spread to the bone or to liver or any other organ, then we can offer a chance to cure with combined modalities of radiotherapy and chemotherapy. Now, for stage 4 lung cancer, that is, when the cancer has gone to distant places, there is a widespread distant spread. In such cases, we do not usually offer cure. So chemotherapy or targeted or immunotherapy is a mainstay, with radiation therapy prescribed to selected patients to alleviate the pain or other symptoms. So you see how early detection uses minimal modalities to attain best of the results, and how late diagnosis can put a question mark on the complete cure.
Sure. Just a quick one there, Dr. Nisha, because a lot of times these lung cancer patients get COVID. So in such cases, what extra precautions should lung cancer patients be taking so that they are safe from COVID?
Now, this is a very important question in the present scenario. Not only lung, but any cancer patient should take as much as precautions that is possible in this pandemic situation. Having said that, lung cancer has a unique relationship with COVID infection, both affecting the lungs and both having similar symptoms. So during treatment, it becomes very difficult to differentiate between exacerbation of the existing lung cancer versus a new COVID infection in a cancer patient. Also, lung cancer patients has almost twice the risk of COVID-19 infection than the general population. And lung cancer itself might not increase the risk of coronavirus complications, but since many lung cancer patients are older and has underlying lung disease and decreased lung capacity and might be immunocompromised due to chemotherapy, chances of complications of a COVID infection is much higher. And hence, prevention is the best strategy. So vaccination, social distancing, and double masking and good nutrition are the only proven ways that we know as of now to prevent COVID infection, not only for the lung cancer patients, but also for the general population. And that is what is the best, thing to do in this situation for lung cancer patients.
Definitely, definitely. So thank you so much, Dr. Nisha Vishnu, for joining us today for this lung cancer awareness series. As we are seeing more and more cases of lung cancer, according to IACR, that is the International Agency for Research on Cancer, which is like the specialized cancer agency for the world, from the World Health Organization, that is the WHO. It has classified that outdoor air pollution is as much as carcinogenic to humans in 2013, citing an increased risk of lung cancer from greater exposure to particulate matter and also the air pollution. Even a 2012 study by the Mumbai Tata Memorial Hospital found that around 52.1% of lung cancer patients had no history of smoking. So it is like it has got so many reasons from where you can acquire this disease, and but definitely smoking remains one of the most common causes.
Primary causes.
Because I think as per the statistics, worldwide over 1 million people die due to lung cancer, and it is estimated that cigarette smoking explains almost to 90% of the lung cancer risk in men and 70% to 80% in women. There is no direct cause of lung cancer.
Yeah.
Things like smoking or being exposed to smoke are like really one of the most important reasons. So stay safe and
totally. And I would like to add one small thing that, you said so much about smoking, but along with active smoking, passive smoking is equally important, an equally important thing to be considered. That is, when a smoker is smoking in the house or, with his friends or at office, it is not only himself that he is exposing to, himself or herself, that they are exposing to, but their family as well, which includes younger kids as well. So when we look into the pathogenesis of cancer, which is like accumulation of mutations or accumulation of genetic damage, it makes a lot of sense that, if a child is continuously getting exposed to smoking throughout his, to a long time, so he definitely has got a very high risk of developing cancer at a later stage without him doing nothing for that matter. So passive smoking is equally important thing that is to be kept into mind when we discuss about smoking.
Yes. One more thing I'd just like to ask you, Dr. Nisha, that there is surface smoking also. Lot of times we have heard, and there are reports also, like even if when you are not there in the room, but you have entered after some person has smoked for some while, like the surfaces, wooden furnitures and all also carry these droplets of cancer related things, which can actually cause cancer. How true is that, Dr. Nisha?
Now, I haven't come across any studies that actually says that, a droplet can, an inhalation of a droplet can cause cancers. Having said that, if you think logically about it, the smoking, basically, what is it there in the smoke or in a cigarette that is causing the cancer? It is a gamut of, multiple carcinogenic gases or chemicals that is causing the cancer at the first place, that is causing the irritation or DNA damage. Now, if that is present in the room and, continuously inhaled by somebody else, that could be a cause theoretically, probably, but I haven't come across any study as of yet, or maybe I haven't read enough, but as of now, I haven't come across any study that says that there can be a surface transmission of smoking, but active as well as passive smoking, of course, is quite important.
Definitely. We must take care of us also and people around us also, that passive smoking is also one of the biggest reasons of lung cancer. Thank you once again, Dr. Nisha, for joining us today for this World Lung Cancer series. Thank you once again.
Yeah, it was wonderful talking to you, Smita. Thanks for having me and hope to see you soon.
Sure.